So what we're going to do is talk about the ecosystem working paper. If you recall, Melissa Stafford Jones talked about kind of an investigation we did about the ecosystem paper, and that's what we're going to do. And I'm here with my friends. You heard earlier, I recommended my sister just engage with others. These are some of the others that you need to meet and engage with. I think we'll go ahead and do introductions, starting at the end, and you can introduce yourselves, and then we'll come down this way.
I don't have a microphone. Okay. Hello again, everyone. My name is Jeanine Gaines. I'm the Director of Partnerships at the Social Changery.
Good afternoon.
Yep.
I'm Hayin Kimner. I'm the Managing Director of the California Community Schools Learning Exchange.
Greetings, I'm Carla Bryant, Executive Director for the Center for District Innovation and Leadership in Early Education at the University of Washington.
Ooh, okay, the woos are going to get louder as we go through this, so. Hi, everyone. I'm Mindy Fattig. I'm a senior advisor with the California Collaborative for Educational Excellence and focusing on special ed and mental health.
Better woos than woes, right? Rich Knecht, I'm the managing partner at the Integrated Human Services Group.
This is an unruly group up here, y'all. You should have seen us trying to get organized as to who's sitting where, but we made it. We made it. It's a pleasure to be here. My name is Chris Hartley. I'm a Deputy Executive Director with the California Collaborative for Educational Excellence. Come on, let's go.
Hi, everyone. Chris Stoner-Mertz. I'm the CEO of the California Alliance of Child and Family Services and our Catalyst Center. We represent 167 nonprofit CBO providers in the community.
And I'm Amanda Dickey. I'm the Executive Director of Government Relations for the Santa Clara County Office of Education, as well as the Senior Advisor on all student health and Medi-Cal issues for the County Offices of Education throughout the state.
Oh, okay. I am Michael Lombardo. I get to facilitate this unruly group for the next hour and a half or so. My background is I was with Placer County as their System of Care Assistant Director, moved to education, and now I'm a consultant for California HHS on the CYBHI. So I get the honor and privilege of working with these folks. Oh. Thank you. Now I'm blushing. So our objectives is to talk about the ecosystem working paper. Melissa Stafford Jones mentioned it briefly in her introduction to CYBHI. But what we did is we were asked by Melissa, some of the folks you see up here on the call, many of you in the audience, to ask our community. The community included stakeholders, family, youth. I think we interviewed over 1,000 youth and family members, a lot. We definitely got youth and family voice thanks to the Social Changery. We asked government stakeholders, judges, legislators, implementation experts. What's going on with our system? What's working, what's not working, and what do we need to change? So here's what they said. They said that we are generally underserving families, that we are missing key resources, and guess what? The reason we're here today is that we're generally structurally siloed. Not a big shock to you all working in the field. It's weird being asked to do this paper and then getting the conclusion we thought we would get, but it was very validated because that's why breaking barriers exists. So what we're going to do today is look at the integrative necessary components to kind of correct course to improve our systems. And we're going to have the panel talk about this today. And then tomorrow we're going to take a deep dive into Placer County System of Care and where they land on these integrative structural components. Richard's going to start by kind of setting some context for us and setting the stage. Not quite yet.
I'm ready if you are, Mike. Is that my cue?
That's your cue.
All right, thanks. Can I just pause for a second and celebrate the Department of Healthcare Services? What Autumn just presented represents, I think, institutional learning, right? Because if you look at the grant that supports the implementation support for the multi-payer fee schedule, you noticed a critical word that's required in the grant process. It's partnership. It's not just implementation support, but the implementation support has to be done in collaboration with other systems, right? And I think this is an example of what we're really talking about when we talk about the ecosystem and the connectivity that's required to really do implementation work well. So I just want to celebrate, as a person who's sometimes critical of DHCS, we're getting it right, so thank you. The eco paper is a long read. If you haven't read it, take it to bed with you. It'll put you to sleep. Unless you're really interested in it, and there are certainly nuggets in it. The way it was researched and formed was, I think, powerful, and it was certainly a rewarding experience for myself. Perhaps the best part of it for me was I made new friends in the process, so I'm appreciative of that. As we sat down to begin to kind of synthesize the interviews and the learning and the research, what popped into my mind was an idea I think that Peter Drucker first represented in the literature a while ago when he said that ideas are cheap and abundant. What makes value and change is identifying how and where those ideas take action and shape, right? Or something to that effect. So we then began to shape the eco paper along those lines, guided by that ethic, if you will, that we needed to have impact. To that end, if the eco paper is to have impact, it's going to take folks way beyond Melissa Stafford Jones and the departments. It's going to take everybody here acting in a transformative and collaborative manner in ways that we haven't done in the past. It'll take all of us in many places over a sustained period of time. This will not be a one-year thing. I think it's important to not view the eco paper as an initiative. The eco paper is a roadmap, a blueprint to how we must work together differently going forward. So the paper's research and interviews clearly supported the biases of many of us that we entered the process with, that lasting and impactful reform work is complicated, it's intricate, it's difficult, and that historically we rarely do this well in California. We often throw resources and change law, but our history suggests pretty clearly that these efforts are minimally impactful and sometimes even make things worse, burdening what should be a healing process. Foundationally, it's a healing relationship, but we burden it with code and prescription in ways that now we have an industry that churns through process and forms and prescription and rules, and the relationships are now secondary, which explains why we're so ineffective often on the ground, right? So really, to get this right, we're going to have to re-engineer systems, and I appreciate that theme has come out already today. So we tried to be aware as possible to this emerging truth from collective impact and implementation science, which speaks to this critically necessary interdependence of three essential efforts. Those three things are vision, structure, and function, and the interdependence of those three things collaboratively, right? So vision to all being involved into what our purpose and intent is, a structure that is mutually committed to and supports and owns the vision such that we don't have to drag our departments into the sandbox, that it's a stewardship of us, a stewardship of one, and that structure can be designed and built and sustained in ways that the collaborative functions that support wholeness, one child, one student, one family, one community, those functions like sharing information, blending and braiding money, all of those things that are technically difficult, the structure has to support those. So I hope it's resonating a little bit that absent any of those three things, reform work is largely wasted. we have to attend. This is why it's so difficult. We have to attend to all three things simultaneously. And it requires really that we put our engineering caps on to do it well. Finally, and quickly to the vision component, you're going to hear some of my really smart new friends and panelists this afternoon talk more about how the vision is manifest, the vision of the eco paper, and getting to whole child services. But I wanted to cite a couple of examples that I've seen since the paper was written in some of my local work. You heard Dr. Powell talk about Santa Clara County, some of those initiatives that go back a number of years in Santa Clara, things like a single system of support, cross-agency service teams, dually involved youth. These are just three of a number. What the interagency leadership team did, supported by its Assembly Bill 2083 work, amplified by the structure of its system of care effort under AB 2083, was they recognized, look, the vision of these is largely identical. Why can't we have a conversation locally in Santa Clara about merging to a singular structure to hold the vision of these initiatives, right? So then the redundancy is identified, and we begin to coalesce what are disconnected initiatives into a single approach. Does this make sense? And this is true for, I think, a lot of large counties. And so over a period of a few months in dialogue about what was needed to bring them into alignment, they used that structure of the system of care under 2083 to support their long-held vision, which allowed them to kind of pragmatically follow through and actionize this. They're in the middle of right now of a process of identifying the redundancies in their meetings, knowing that if busy executives that go to the same meetings to talk about the same stuff 2 or 3 times in 1 month can figure out where the connective tissue is on the content, then they can actually save themselves an hour and a half or 2 hours of bandwidth every month, right? Like, wouldn't that be great? In addition, of course, to synthesizing the work. A second quick example of the interdependence of vision and function comes to mind in the work of Sacramento County and their system of care efforts. They wrote a lovely purpose and vision into their system of care MOU under 2083. That was the easy part. That vision, not uniquely to Sacramento, but very important, however, was that the system of care was larger than just foster youth, and that you can't build a system of care just for one cohort of young people. That vision for Sacramento of a larger system of care for all young people only began to have deeper meaning as the department heads really committed to a disciplined set of leadership meetings at 2 levels, and led by their presiding judge. And when the administrative supports and the facilitation for those meetings were put in place, first by the Department of Child and Family and Adult Services, and then immediately by probation, joining, stewarding the operations of the oneness, if you will, right? Meetings, agendas, minutes, calendaring, jointly held. It became apparent and obvious, and people began to realize, okay, this is us. This is the structure of us. It's not just one department dragging partners into the sandbox to implement something, which we've been doing for decades, right? This is the change in mindset Dr. Powell's talking about. This is the transformation of how we see ourselves within the larger ecosystem. And the vision of the MOU then began to take greater form, and they have had numerous impactful conversations supported through really disciplined leadership. They meet every single month, 2 hours every month at an executive level, and then 1 hour at the actual ILT signatories. So Sacramento has committed to this, and they're beginning to see positive impacts from this. So again, bottom line, vision, structure, and function all have to go together, and we have to understand how they work together. Otherwise, we erode really quickly. It comes unraveled, right? As soon as the dollars go away, or as soon as the next glitzy thing comes along. So got to pay attention to all 3 things, and I think you're going to see hear about some great examples this afternoon of where this is taking place. Mike?
Oh. There we go. Try that one. There we go. Can you hear us in the back? Okay. There we go. We'll do that. Okay. So what I didn't tell you, and maybe my panelist, is that I'm also the timekeeper. So each group that you're going to see present in the next section, first on visions, mindset, and culture. Hayin and Jeanine will talk about it. They will get 18 minutes. And then the group after that, 18 minutes. And I will hold you to it. So I'll go ding, ding, ding or something, and the audience will help us to keep us on track so we could get to Amanda's section. All right? So the questions for each group of panelists are, which do you see as the highest priority under vision, mindset, and culture? And these elements of clear shared vision, community and families empowered as partners, and commitment to address the root issues in structural inequity. So I want you to respond to these questions for each of those elements. Which do you see as the highest priority? How are you already working with that priority? And then what additional support do you need? Because we're in a room full of supports. So Jeanine and Hayin.
Okay, well, let's go really fast because I have only about 9 minutes to go. I'm kidding. I'm Hayin. I am a community school nerd, a practitioner. I have very vivid dreams at least twice a week about LEAs doing things, trying to figure out their community school strategy. So I care a lot about this. And I think this moment in California is both exciting and absolutely terrifying because $4 billion is a lot of money. And everybody's watching because when you have a resource-strapped system for young people in this state that we have divested from decade over decade over decade, and then you pump $4 billion and then you like sprinkle words like alignment, coherence, equity, and transformation, it's gonna work, right? We've never had these ideas before, right? Rocket science. How many rocket scientists are in the room? I'm so glad we're here. So when we think about the vision, the culture, the mindset, check, 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 hallelujah, amen, everything that Dr. Powell said. And my question is, when we're talking about vision, mindset, and culture, why is this so hard? If these aren't new ideas, what are our barriers and how are we getting in our own way? What do we need to do to move the chair behind all of our things? Because in education, I'm sure this is just education and just in California. We really like to fix things. We like bright spots. We like playbooks. We like toolkits. We like all of these things because if you do these things, then obviously we will get to this problem. We will get to this state of Shangri-La where there are no problems anywhere. But if we're not really taking seriously some of the more difficult conversations upstream, what are we doing? Do we have courage to have some of these conversations? So with that, that's the stuff that keeps me up at night and wakes me up in the morning, in addition to my 6-year-old. A couple of slides that I'm just gonna go through really quickly, and this is a bit of, I hope you didn't miss that really fun animation. Some work from the national perspective. As part of being a nerd, I get to dive into nerd research and nerd huddles, as many of my colleagues in the audience today, I see you. And this work comes from the Community Schools Forward National Task Force, which was a national effort of folks like myself who have spent decades doing community schools work and trying to think, like, why is this so hard? And fundamentally, when you have a bunch of community school experts in the room and you say, well, what's a community school? And nobody can give you a definition that's shared, you're gonna have a really hard time with policymakers, with funders, and then the researchers are gonna absolutely go bananas because they're like, but what are we measuring? So the whole idea of having a shared framework was really important. And it was also an opportunity to make very explicit things that are oftentimes not made very explicit, Like, why do we do this work? The reason why we do community schools work, the reason why we believe all schools should be community schools is not because we have to fix all the poor kids. The reason why we do this work is because we want all children to thrive. We believe schools are an integral part of how children thrive and how communities flourish. Am I right? Oftentimes when we talk about community schools, we're not talking about this. Our why is about like fixing things, diagnosing things. Those services are absolutely important, do not get me wrong. But our why in doing this work has to be about young people. That's the vision. So then the question is, what gets in the way? Money, sometimes. Control, inability to learn, inability to actually look back and have some humility to be like, oh, I shouldn't be in charge of that. Maybe somebody else should be, right? The other pieces around this was really talking about, Jeanine said she was going to stand, so I'm going to do it too. Woo! Good times. Who drives this work? Everybody drives this work. And when the task force was talking about this, we pulled out 3 particular sort of stakeholder groups. Not because they're the only ones that do this work, right? A lot of community school grantees across the state have hired a bunch of people and they're like, they're gonna do the work. No. The people that are doing this work have to be school staff and coordinators for sure. Youth and families, we heard about that this morning. That was the challenge from our young people today. Look around. And then community partners. I can't tell you how crazy it makes me when I see community school conversations and all these planning groups and there's no community partners. And the community partners that are there are invited as vendors. Come on, it's a community school. And then the piece that I think is most important to me about this work that really that requires us to lean in to these questions around courage, control, and learning are about these enabling conditions. If these enabling conditions aren't in place, you're not going to have a shared vision, you're not going to have the right mindset, and you're going to have a culture of an echo chamber of the same people that you always listen to. Talking about trusting relationships is really important to labor management relationships. Is anybody having a hard time with labor management relationships? No, not in California, no. Good, awesome. Anyone having a hard time with really thinking about connecting with community and connecting with our young people? No, great, cool, good vision. What are those barriers? How are you taking responsibility for them? How can we make this not just about buy-in for a vision, but ownership of a vision, accountability for a vision? What is getting in the way? And how do we start to create some of the safe spaces to have those conversations? Because these ideas are not new. Community schools in California are not new. Integrated systems are not new. But I really have a hard time, 4 minutes or go away? 4 minutes, okay. I have a really hard time thinking about how we're gonna move past this particular moment when we are both flush with cash and on the precipice of a fiscal cliff. And we're gonna hold on to these ideas of equity and transformation. We gotta lean in. That's what's most important to me. Bye.
Perfect. Okay. Well, if you left me 3 minutes, that means I just get to go on and on. Now I have 12 minutes. So very excited about that. So I am going to stand because I got to give you guys the old razzle dazzle while I'm up here. So as I said, my name is Jeanine. I am the Director of Partnerships at the Social Changery. And I'm going to kind of talk to you guys a little bit about what we are doing with CYBHI. So this portion is going to be kind of like more case study-esque. I'm just going to talk to you about what we've done the past few years and what we have heading on into the future. And then I'll answer these questions like while I'm talking. So when we were talking about vision, mindset, and culture, there's a couple bullet points in the working paper around what that looks like. And so those are clear, shared vision by, for, and with children and families, communities and families empowered as partners to elevate their interests, and commitment to address root issues of structural inequity. So what we're doing with, we call it the CYF network, or the Children, Youth, and Family Network within CYBHI, is really looking to provide a foundation and infrastructure for strengthening, deepening, and increasing the engagement of children, youth, families, and the entire community. So I do want to put a couple caveats out there. First and foremost, CYBHI has done an awesome job of engaging with youth and families throughout the whole process. So we're kind of coming in at a specific moment in time, but work has been happening. But really looking at how is it not just like one-off engagement, but really keeping the youth and families engaged the entire time. So if we want to go to the next slide. Nope. You still had more slides.
No, I know. I stopped cutting.
Okay. All right. Nope. Go back one. All right. Perfect. So our first charge was to really put together the network. So we worked with different organizations that had already had a history of working within CYBHI, but really looking at how do we find 15 organizations that represent the entire diversity here in California, looking at location, looking at our 5 CRDP groups, different age ranges, making sure parents and families were included. It was a pretty high task. So we have the list up there of the organizations that we worked with this year. And many of those organizations had actually helped create the Youth at the Center report that we talked about a little bit earlier, and that I'll talk about a little bit more in depth during this 9 minutes. And then we also, it was really important for the network that it wasn't just nonprofits kind of off in our own little silo, but having the work streams that Melissa had mentioned, the 20 work streams, having them be a part of this table as well, that we're all working together. It's not just the organizations down here kind of talking up, but us all having a seat at the table to be able to share, hey, this is what's happening in the community, this is what's happening at the state, how do we bridge this? It was really important to have this reciprocal model because yes, there are things happening at the state, but we can do that all day long. But if the people who we are supposed to be working with and for and serving are like, that's not my issue, I actually don't care about that, then what are we doing? We're just spinning our wheels, we're making things nobody cares about, and we'll find ourselves back in the same situation next year. So it was really important to have everyone have a seat at the table. Really, a lot of these organizations represent a network of network. So this was not just, hey, you have to be one of these golden 15 to be a part of this. There were other opportunities to participate. And also, like I said, these groups represent other groups throughout the state. So we were able to tap into those networks to have a further reach. And one of the things that I want to mention is you'll see that these are organizations that are a part of the network, and it's not individual youth and families. And that was actually a conscious decision that we made. I came into the organization in March. We launched in April. So it was a pretty quick turnaround. And honestly, this is something new. We didn't know what the engagement was going to look like, and we felt that it was really important for the safety of young people and their families to ensure that we knew what was happening. I have to be able to explain, this is what you can expect. And also, if we have young people who are sharing their stories, families who are sharing what's happening, or there's something triggering, we have to know that there is a safety net to support them. So by working with these organizations who will then bring in youth and families, we know that that organization has their back. And it's not just that we hopped off a Zoom call and it's like, oh, hopefully, you're able to go about your day. So that safety was really important. And I'll kind of talk about how the next phase of work may look, but that was intentional, not to just grab youth off the street and have them be a part of this when we didn't know exactly what it was going to look like. All right, so this is a little roadmap of what we've been doing so far. So leading up to the launch of the CYF network, the Social Changery and CYBHI and the work streams had done tons of interviews with youth. As I mentioned, the Youth at the Center report was one of our guiding documents, but there were also key informant interviews done with organizations. this work is types of work like this have been happening for a long time. So it was really important not to just do the same old thing. So really listening to our nonprofit partners and hear, okay, how have you been engaged before? What does that look like? And we had heard a lot of like, hey, you know, we've been in situations where there's a golden nonprofit and they're the ones who are leading the way and we're just all filling in. And so we specifically heard they did not want that. And that's part of where the Changery came in, that we're helping to facilitate. So we are out of the work. We're not trying to like jockey for position while also doing the work. So we had tons of information come up in those key informed interviews. Then we created a list of recommendations, worked with the workstream partners and CYBHI leadership to say, hey, this is what we're proposing. This is how this could look. And then we sent out invitations for partners to join. We did one-on-one meetings just to talk about what that would look like and made sure everyone knew this is an interim network that we have. This is not the final because we don't know what it's going to look like and we don't want to set something in stone. It's like, well, that didn't work, but we already wrote it in stone. So everyone knew this was interim. We're really going to feel it out, really focus on quality and lessons learned as we go throughout the year. So we had our first kickoff meeting in May and really looked at the engagement ladder. What does it look like to engage youth and families? Are we doing co-design? Are we just having them come in and tokenizing them? What does that look like? Let's have a shared language around what does engagement look like. We had planned on actually having 4 meetings and we decided to add, you see in July there were 2 meetings, and that was because we realized that we did not have a shared vision at this point. We were not speaking the same language, and it's really important that everyone feels comfortable and confident. You can't move faster than the people that you're working with. So we had an interim meeting just to really introduce what CYBHI is, what the work streams we're doing, to look at the Youth at the Center report and the recommendations within that, and then also looking at the equity toolkit that had just recently come out, because all of the decisions that were being made were going to be rooted in equity, in engagement, and within the work of CYBHI. So we had that meeting just to make sure everybody was grounded in what we were doing. And then for July and September, we really got a chance to do this feedback. So what we would do is we would meet with the work streams. They would let us know, hey, this is what we're grappling with. This is what we need support with engagement. So whether it was looking at stories from the field and if that was going to resonate, or how we can work with specific populations, like what does it look like to work within the Native community? What does it look like to work within the LGBTQ plus community? Really meeting with these organizations that represent those groups to say, hey, this is how you do that. This is how you strengthen the engagement. This is how you don't tokenize. So really getting to wrestle with those areas within the meetings within this larger group. So that's what we were doing in July and September. And then also in September, looking at, okay, now that we've had a chance to wrestle with this, now that we see what's happening at the statewide level, what's happening with youth and families, how do we move forward? What does this network need to look like? So we met in November to do draft recommendations, and you'll see our little arrow. The green one, that's us right now. So we're currently working on those recommendations. So some of the recommendations, and I'm highlighting the fact that I'm saying recommendations. No one said, yes, this is what we're gonna do. But the recommendations that we have, one is now I think that we're ready to work directly with youth organizations and youth groups. I mean, obviously we have a killer youth group like sitting right here at table 8. So getting young people like that who are already engaged in the work, like their voices need to be heard. They should be like leading the charge with this. So working directly with youth organizations to give their feedback, having this reciprocal feedback loop. But then also there's a lot of great things happening, as you've heard with CYBHI. So how do we take those things and share them out with other youth? So using them as an outreach arm, and then for them to do that quality control piece. So working directly with youth, still having a group of organizations that's supporting the work and working with the work streams and their vendors, and having this learning collaborative piece, and then also doing work not just virtually but meeting in person in different regions to ensure that everyone, not just this table that we're working with, but all of the people who are doing this work are able to come, meet, and really just break down those silos as we've been talking about this whole day. So that is where we are headed, and I think I'm good on time. So
Excellent. I'm discovering how hard it is to facilitate such amazing people and hold them because they literally could speak all day and are such a wealth of information. So we're going to move on to the next section with Carla, Mindy, and Chris. And they're going to talk about structure, organization, and resources. Same questions to you all as you go. And again, 18 minutes between the three of you. So I'll kind of track time for each one.
Is it on? Yes. So I'm going to take a pause and go to the side here. He and I were joking. I shared with her that a year ago I was asked to do the keynote at my alma mater. And I looked out and I saw everyone and I said the following to them. You are the smartest people in the room. There is nothing I'm going to share that you don't already know. So that being the point, all I can do is share some thoughts. And the thoughts are going to come from the tension between what happens on the ground and what happens in these wonderful systems that we're creating. And to do that, I'm going to do two things. I'm going to share two different stories. One is a little bit about me. The first, in fact, at the very first Breaking Barriers, I shared with everyone this story about I am just damn good when it comes to talking about early childhood. That's what I do. Could talk about it, could give you the research on it, and then something happened. I adopted 2 children from foster to adoption between 2 different states, Texas and California, and I realized I knew nothing. I apologize to all the mothers, fathers, parents of children, and I realized you gave me grace. The grace you gave me is that you knew I knew nothing, and you let me talk. We are sitting on grace, people. We're talking about people we may not know. You've been given grace. So here I am, 10 years forward, and I have to say I'm looking at Ken. I can give him a hug. The people I've had to lean on as I tried to maneuver a system that we created. That as a person who thought I had it together and understood the very thing I put together, I can't even maneuver. So I want you to, I'm going to say it again, you are sitting on grace. Right now today, and I can't help but look at Ken. I'm telling you, I'm having an aha moment. EBC, Children's Health Council, I have participated in this in 2 ways. One, as a parent, and 2, as a person who spends time with you developing systems to serve the children who look like me and not doing a good job of it. So I know you're going to celebrate yourself, but I'm not here to celebrate you. I got to be 60 and I'm just over it. I am. So here's the second story, and this is a true story. I'm going to talk about a particular set of children. There are 12 of them. 12, 13, the group changes a little, but it's a core group. These are high school students. Their parents or educators work at different universities, all the way down to being maybe a para in a school district. These 12 children account for, anecdotally, about 80% of all the fights. Their absenteeism is off the roof. I sat back and I looked at these kids and I thought, did we not know this? Went back to the middle school. Every child could be identified by somebody in that middle school. Went back to their elementary and preschool. Every last one of those children were high flyers, going through the same system. One of the questions I found fascinating, and I thought, oh my God, Melissa, you're right. The stigma is held by the adults because we know what data means. We know how information used inappropriately creates havoc. So I have just a thought, and these are 4 thoughts. Now let me go back to that system where these children are at. They have a health center. Actually, I had a conversation with administration, and they're like, we have 100 clubs. And I looked at the person, I said, well, clearly they don't want your club. But it was a system that the system was engaged in keeping in place. Because they were meeting with everybody, they got it down. This particular system, they have a strong partnership with the city. I'm only talking about 12 kids. There are other kids. But this particular group, I'm watching. So what are the 4 suggestions I have around our systems and what's happening on the ground? The tension between our well-intentioned systems and are we delivering on this promise that we're talking about? So here's the first one. Here's the first of the 4. We need to reimagine what we think mental health is. It has a cultural aspect that I have not seen people elevate to the level that they could serve these 12 kids that have not been seen by the system. Why were they not seen by the system? Because they don't meet the DSM-4. Okay, can I say it? If they were cutting, anorexic, bulimic, but instead they present as aggressive, angry, mad. The decision making by the adults sends it down a criminal line versus a mental health one. So the first thing we need to do is reimagine how we are imagining how people should demonstrate how you can come up with your code. That's number 1. And I'm coming from, and don't please come up to me later and say you were passionate. No, I'm pissed. Because I'm living it. And we are invested in keeping this going. The girls are demonstrating depression. And I asked the administrator, I said, you think these girls want to fight? That's not normal. Comment was, it's just what's been going on for years. And everybody knows it, but nobody will talk about it because they don't want to be culturally incompetent and demonstrate a little bit of racism. Let's have a little bit of it. Let's just have a conversation that's real so we can get to the place that we could talk about how to serve these children who are demonstrating mental health issues in another way. So that's number 1. Number 2, FERPA, HIPAA. As a parent, me first, tension. As the person who developed all those beautiful systems, I love some data. And I love to talk with my partners about how could I get their data? How could I learn more about their children? All of a sudden, when I had children, I don't want you to get the data now. I will not sign off on a single thing. Do you know why? I don't know how you're going to use the data. I don't know if you're going to use the data to poverty pimp my child. I don't know if you're using the data to answer the question that I have. So here's my suggestion to you. Ask me what I want to research. When you research, you ask what's wrong with the kid and the families. My question is, what you doing? My question is, how does the teacher perceive my child? What is the filter that they're using? But let's be honest, you know I can't ask a teacher that. I can see the union people right now twitching. And you're twitching because you're afraid the way we're going to use the data against you. So there's a lack of trust in the data. Do you know how you get around FERPA and HIPAA? The family. I sign off on everything if I trust who I'm talking to. That's how you get it. Don't worry about the system that's giving you the barrier. Develop some trust. You're talking about developing trust with each other. Develop trust with the community. Develop trust with those parents. Which brings me to, why do we have these bright spots? These bright spots are solving a problem that they can't wait on you on. And when they go away, the bright spot goes away. But what we're not capturing is, what is it about what they're doing that make it a bright spot? So I'm gonna go to the 12 kids. The parents have gotten together behind the district. And we were organizing. Do you know what we say in that meeting? They don't know, they don't know. They just don't know. And it's too much energy to try to convince them. So we're gonna solve it, and then we go away. But then the issue comes back. So how do we capture the bright spot? I don't have the answer for that, but you need to figure that out. But there is a way to capture it. And we, on the surface, talk about it. And here's the surface part we talk about. The surface part that we talk about is, we invite parents into the room. You're not inviting us into the room. Stop playing it. Let me give you a perfect, I've been on so many parent groups. I was 2 months into a group. You know what the person said to me? You're not a regular parent. He went back and researched me and came back and told everybody. And the conversation flipped. Rethink why we're bringing parents in. Rethink why you're bringing that person who started the bright spot in. We talk about reciprocity. Reciprocity is a belief that we all are equally empowered. But if we're setting it up where you are the one with the power, it's already wrong. Last one. I'm calling this the pull up. We all want the same thing for children, but how we get there is where we disagree. This is where the tension is. And this is where the tension is even about our children. My high schooler went to school dressed a certain way, and I was like, ooh, Jesus. I mean, I was just appalled. It took a lot of conversation to get to the, well, that's not what happened. I actually went up to the school and said, oh, Lord, she dressed a little bit better than what I'm seeing. We have a different understanding of what good dress is. We have a different vision. It does require that we get to the next level. Saying that we all want the same thing for children is not good enough. We have to go deeper. We have to find out what good enough looks like. And it may not look like what you're working on. I call it paper to parent. Someone said share this. I work with a district that has some of the best paper I've ever seen. It's so well researched. You got so many PhDs, EDDs in behind it. It looks good. I actually use their paper. I mean, it looks good. But when you talk to the parents, they don't know nothing about what's on that paper. It's called parent to paper. If the parents don't know what you got in that paper, the paper means nothing. How do you get to the real work? You get to the real work by asking parents, again, what they want to research, how they think it looks, and you ask children this, and then you work from that.
Feel like it should be like a mic drop at this point. Like, you go, girl.
I'm over it.
She's pissed, and she's letting people know it. Good job. Chris, I'm going to let you go first, and then I'll. Oh, okay. So, in following up, how do you follow up, Carla, right? Thanks. Good job. But a little bit, I'm mad too, girl. But a little bit about mine. You know, we have similar journeys in our lives. And this, I've been at Breaking Barriers. Remember when it was at the top of the Citizen? and everyone was all crammed in there and tiny. And I was like, this is the people that are going to change kids' lives are in this room. And we have the collective power of one to do that. And I do not want another parent to have to experience what I did, where I had to go drive my daughter to a hospital in Oregon to get mental health. We live a little closer to Oregon, because I know California hospital would release her because we're a, quote, good family. Wouldn't give her support. We live in a very rural part of California. Services are incredibly difficult to find. If we don't come together to provide help for our kids are not getting help, period. So driving to her hospital in Oregon, because this is my daughter's 3rd suicide attempt. And I'm in the system. I'm in it. I was a principal of Continuation High School. I was director of special ed at county office. I know the system. And what did I have to do? I had to get my child a label to get help. We had to go through the DSM. We had to jump through the IEP hoops just to get her help. And I knew the system. 99% of our families, where do we go, right? It doesn't matter if you have private insurance or Medi-Cal. The doors were shut. If I didn't have Medi-Cal, the door was shut. I couldn't get help because we had private insurance. That shouldn't ever, ever happen for our families, to have to navigate what door, because of what insurance, because of what label your child has or does not have. And it starts with the kids. And I am so inspired by you guys. I had to place my daughter in Utah to get help. And it pisses me off that we still have to place our kids outside of their home community because we cannot get together to provide the services that they need when they need it. And not wait too late that it's a crisis. Providing proactive support to our kids in healthy mental health situations. So take me to where I am now. I'm fortunate that I'm at CCEE, which is a state organization, and one of the 3 state agencies in California. And we have an opportunity to deconstruct the system with everybody in this room. And you know what? And we're going to accomplish it. There is no if, there is no when, it's now. Okay, you heard some fantastic things that are happening across the state. We have a lot more work to do. And the system needs to be reconstructed and reimagined. And because we're leaving kids behind if we don't. Right? And so I'm going to turn it over, because I know I'm going to run out of time, to Chris with CC.
Holy cow, you guys. I'm just so grateful to have you as colleagues and to be in this space right now with just everybody in the room. I want to, who did the breathing exercise earlier? Is he still here, that gentleman? I'm just kind of taking it all in. I've got 20 seconds. Michael, I started my own timer. No, it's just, I just will close with a remark that Richard made earlier on about the report, and that the report already validates really what we already know. And unfortunately, these aren't the first times that we've probably heard stories, just like what we've heard from, there's my alarm, Michael, from Carla and Mindy.
It's our fault. It's our fault. He's Eric, Chris.
No, wait.
Okay.
I got it.
Team effort.
Throw that thing away. Hey, if nothing else here, I'm here for comedic relief. You know, is that the report validates everything that we know. And I think really the thing is that the bottom line is the success of our children and youth really require our collective responsibility, right? And our collective commitment to do the work. To take our collective commitment and get behind making sense, try to make sense of a difficult system, to stay with our strategic plans, to stay with the work that we know is making a difference, to focus on that proactive work, recognize when we're being random and we're being reactive, and all the things that you all just described that create that structure that just repeats itself and repeats itself. We've got models out there upon models upon models. We talk about the idea of needing to coordinate. We talk about the importance of collaboration. We talk about relationships all day today, right? But how do we truly get to that place of integration if we don't stay steadfast to what we know is true, our commitment to make a difference, to change the structure of the system, and to behave differently. How do we truly do transformational work? Or are we just gonna do transitional work, do different things, call it the same thing, right? Are we gonna truly do different things to help students? So I think that's just the message that we would talk about and kind of put a capstone on as far as the structure goes. It truly is a mindset. We talk a lot about in our community engagement initiative work at CCEE about the importance of building capacity. And I get so tired of hearing that word, like what does capacity mean? And so I'll leave you with just this thought bubble that you might want to pull up in your own research. But Dr. Karen Mapp out of Harvard's done some really good work on this topic of capacity. And it's helped us as an organization look at structural supports. She comes down to 4 domains on what it means to build capacity. How do you increase capabilities for an individual or organization? How do you increase cognition? And Dr. Powell, you were talking earlier a lot about mindset and beliefs. That's a part of capacity. How do we deal with confidence? And how do we make connections that are worthy? Just leave you with that thought as far as structure goes. I love this panel and this format. Michael, you're doing a great job. Thanks, everybody.
Thank you, Chris. We're going to turn it over to Chris Stoner-Mertz and Amanda Dickey, but we're going to use that microphone because, no, this one handheld, because we seem to be getting some feedback. So take us home, land the plane, you two. You got it.
No pressure. Great, thanks, Michael. Can you move our slides up a little bit there?
There you go.
I'm going to hopefully tie a little bit of what this last group just said together with the areas of, actually maybe go back one, of function, process, and outcomes. And you know, there's 4 areas here, but I want to bring it back to the actual work that we're talking about doing. And I want to ask the audience a question to start with. You know, you heard some really personal stories here, and I'm just curious in this audience, how many of you have or are near a story like that? So our charge today, and for the rest of our lives likely, is to be that translator between what we know and experience as parents or aunts or uncles or grandparents with what is happening in the system. And if the system isn't working, we got to look in the mirror and we've got to come back to why it is we're doing this work. Some of you have heard this story of mine, but Elizabeth and I knew each other before we actually knew each other, because I had a foster son in a school district that had some behavior problems that resulted in him being kicked out of school. And of course, my personal advocate went out to all my friends, some of them in this room, and said, what do I do? Like, what is going on? What is happening here? And how do I fight this? And of course, we got an attorney, and we fought long and hard. And ultimately, because he was also an African-American child in a primarily white, Caucasian, upper middle class school, we ultimately made a claim against that district for racial discrimination, as well as a lack of addressing his educational needs. And long story short, he ended up back at his school, getting the supports that he needed, and is now doing a wonderful job as a contractor doing work in building houses. So maybe he's out there remodeling your home. But I found out, I think probably 2 years later, when I got involved with Breaking Barriers and started talking to Elizabeth about her work as an educational attorney, that she was actually on the other side of this situation. And she was the one that was saying to the school district, you need to figure this out. this is not about this child. This is about a problem with this school. And thankfully, because of her and others in this room, very likely, that assistant superintendent sat down with us and said, we're going to be doing some training at that school. And I said, well, how are we going to know that this training is actually going to make a difference? And that superintendent said, because I'm going to be the one doing it. And that was the kind of commitment at a leadership level that I think we all need to emulate when it comes to looking at those, as Carla said, those 12 or 15 or how many other kids we're talking about, and really addressing what those root causes are that are resulting in our systems not meeting the needs of those kids and families. You can go to the next slide. Amanda and I talked a lot about these various functions and frankly, I don't think one of them is more important than the other. They all have to come together ultimately with the question of how are we actually getting at the issues that our children and our families are struggling with, right? And I think when I think in general about the CYBHI, the biggest challenge for us as the people that are supposed to be seeing all sides of this and are the translators of it is that we have to ensure we're coming back to why are we doing this work? What is the student's needs? Is that health center actually addressing their needs? Are they asking for something else? And how do we make the system change and adjust and use all of this money that's flying around to actually address that problem, right? Not to say, how do we fit this child into whatever it is we've been given money to create? It has to be the other way around. So I'm going to pass it over to Amanda to talk more about, actually throw up that next slide real quick. I pulled this out of a sort of organizational change format because, we like PowerPoints. It looks nice on a slide. But the key takeaway here for me was, what is the community defining as the need? And how are we then using, as Amanda will talk a little bit about, dashboards and communication to actually address those things, not just the goals and outcomes that our systems want to see because that's what the grant said or that's what the medical model said. We can work magic, and that's our job. Like, let's be that Wizard of Oz behind the curtain, so the youth and the families don't have to see how it is we get the money. They get the service they need. We figure out how to get the money. So I'm going to hand it over to Amanda to talk about dashboards and how we measure this.
All right, Amanda's going to land the plane for us.
That is a big task. Okay, I'll do my best. So one of the questions was, what do we need? What additional supports do we need to make this happen? Well, I think what the paper culminates in is this idea of we need a single integrated whole child and family dashboard that is strategically created to encourage change, collaboration, and joint movement towards a common goal for all kids, right? So that all of these stories that we heard today with these individual parents who have had to be advocates for their kids, that is a massive amount of work, right? And we just wish that the system would work for all kids so that we didn't have so many stories. I think that was a great question that you asked, Chris. How many people are impacted by this, right? By these various different systems issues. So you might say to me, well, cool idea, Amanda, but we already have a bunch of dashboards. Like, really, what is that going to tell us? And this up here is an example of one existing dashboard, right? We have an education dashboard, and it's a pretty good dashboard. It's pretty cool, right? There has some interesting metrics there. It's valuable, one would argue. But the dashboard for education, the state education dashboard, measures only outcomes. And one of the things that educators amongst ourselves often talk about is how frustrating that can be, because so many of the inputs that impact the factors on the dashboard, so many things that impact the outcomes that you see here, like chronic absenteeism or suspension and expulsion or academic performance, are all outside the control of schools. They are very much dependent upon the other factors in your community and whether certain needs are being met or not being met, various different characteristics of your community. So let's go to the next slide. So let's say, so everyone has the school dashboard, right? So maybe in your county, you have a great county like mine where we have some other dashboards, right? So maybe you have a county dashboard that also has information about households with children and poverty rates and ACEs. And maybe that dashboard also includes information about homelessness or adult incarceration rates. I don't personally know of anywhere where this exists. I know that there are lots of different dashboards, even in my own county, where there's a dashboard around incarceration and there's a dashboard around ACEs and there's a dashboard around mental health, but there's not one dashboard that integrates this information together. Let's go to the next one. And there definitely isn't this. So this is what I would call an integrated systems dashboard. This indicates to us, are agencies working well together? Are they coordinating and are they collaborating? I don't know anywhere that's looking at these various different factors. And I wish I was smart enough to have identified these factors, but I'm not. I had some conversations with various different folks in the field, superintendents, folks at behavioral health agencies, administrators within counties, and I said, if you were to tell me what are the top 5 factors that are good indicators of whether or not agencies are working together, and when I say that, what do I mean? I mean, is the foster coordinator at the County Office of Education working well with the foster youth services folks at the county? Are the Medi-Cal coordinators at the county working with the Medi-Cal coordinators at the districts? And these were some of the things that they gave us. So Medi-Cal churn is a great indication of, are various different agencies working together? Is the county agency coordinating with the district, for instance, with this whole like redetermination thing, which hopefully everyone in this room has heard about? It's a bit of a nightmare. Apparently about 50% of people have been kicked off of Medi-Cal in the last 6 months or so. But when you're coordinating with your school, there's a better chance that you're going to have less of that churn caused by redetermination. Similar, the one that always gets me, I found this one fascinating, children with IEPs. So First 5 LA did a study about 5-6 years ago that found that the number of kids with an IEP or ISP or IFSP, which in other words just means a student with a disability or a child with a disability, at 3 was, let's just say it was 100 kids. And then that number dropped dramatically the next year. And then it slowly crept up and crept up and crept up. And then all of a sudden it was back at 100 by the time the child was 7 or 8 years old. What does that indicate? Who knows? Not talking to your regional center, not coordinating between districts and regional centers to have smooth transitions of 3-year-olds. So, right, the whole concept here is we've designed a system that in theory works, great theory, cool ideas, but realistically, those transitions, those relationships are not really happening. And nowhere is all of this, all 3 of those dashboards I just showed you, in any one place. Nowhere. It does not exist. Let's go to the next slide. So what if we could take all of these thousands of data points that already existed, and I'm not asking to collect new information because that's expensive, and I'm a lobbyist and I don't really want to put a bill out there saying we're going to collect a whole bunch of more information, it's going to cost $1 billion. But if we connected them, if we put them all in one place and we connected them and we mapped inputs and outcomes, that would be incredibly useful for the field, because this is really complicated. Like I'm not smart enough to be able to map all the different relationships, right? I'm not a statistician. No, to my knowledge, there are really no statisticians within counties who specialize in this kind of work. And what we're essentially asking folks in the field to do without having this data exist somewhere and in a way that's mapped and understandable is we're asking them to, one, redesign the wheel 58 different times at least. And then also we're asking, I think to the point that Carla and others have made, they bring their own biases into these conversations, right? Everyone brings their own biases. Everyone brings their own perspectives into these conversations. What if we could create something that Chris would call a tier 1 tool? It is not meant to be a tier 2 tool or a tier 3, but a tier 1 tool to at least bring the information together, map it together, and then do some root cause analysis. Can we go to the next slide? Let's start with the first one. So this is an exercise just to challenge our personal beliefs and perhaps some of our biases. So let's say we have a scenario. We have RBG Elementary School with high chronic absenteeism rates. What do you think might be the root cause of that? Anyone? Throw out ideas. Lack of transportation. Let's go to the next one. Well, what if we find that as a factor that we learn from looking at our dashboard, there's actually a really robust school and public transportation in the county? Then what is our root cause then? Could be. What else? Could be school climate, could be, let's go to the next one. What about ACEs? What about a bunch of adverse childhood experiences? Well, let's just say that in this particular county, because we have this information on the dashboard, ACEs are actually really low and students report low rates of depression and anxiety. Okay, so now you have 3 factors that are telling you information about this district. Now what do you think is the cause? That's a great one. Next. That's okay. What if I were to tell you that actually 80% of the families have completed the Brilliant Beginnings screenings on time, and that actually COVID-19 rates are low? Now you have 4 different factors, 4 different pieces of information. What's left, right? So you go through this process, and we all bring to the table these biases, these beliefs, these preconceived notions of what is the cause. And let's just go to the next one. And then we find out, because we have this dashboard, that adult incarceration rates have actually tripled in the last 3 years. And young students are experiencing really unstable homes, that there are more students than we've ever seen in the foster care system because they're being removed because their caretakers are being incarcerated. Like, this is an exercise essentially intended to demonstrate to you that without all of the relevant information, we make a lot of assumptions about what's going on in kids' lives and families' lives. I think what's most important, right, is what Hayin and Carla talked about, which is listen to families and listen to kids, but also create a data system so that we don't have to reinvent the wheel over and over again, and that we're asking the right questions and mapping the data in valuable ways, so that we're not asking every county to basically become an expert in understanding all of the different predeterminants of health and success. So this is another just kind of example. What it's intended to demonstrate is that there are millions of possible combinations based on these various different factors, thousands of different factors. And let's be clear that this is overly simplified. There are generally several root causes behind any particular issue. But the idea behind the tool, again, is to be a tier 1 support that gives folks the right questions to ask and potential root causes that they can then explore. If we go to the next slide. So again, so let's say that we have this tool, and let's say we actually have a root cause analysis tool, and then we can actually then get to having conversations about what are the things that children and parents need, right? Again, listen to them, but also look at the data. And we can see, once you've identified some of the root causes, you can start digging into what are some of the possible solutions. So if we're talking about an opioid epidemic, if you have no other information about a county, no other information about a situation, you might go in one direction. And if you have this additional information, these additional factors that you see here, for instance, on the slide, like high unemployment rates, no family planning clinics, high Medi-Cal churn, no methadone clinics, that will tell you more information that you need in order to think about what are the possible solutions here. And then also what's really key is what are all the partners that you need? Because I think if we were to sum all of this up, right, this is a one system, and we need everyone in the system to be working together to address these joint shared problems so that we can get to, better outcomes for all kids. We're not fixing a problem like Hayin talked about, but we are trying to create a system that supports all kids and all families based upon what they're telling us, but also the information that we have and the various different unique factors of each community.
And of course, we had to have one slide on funding.
Nope. There.
Because that could be a whole other day-long presentation. And I know that many of you struggle with the acronyms and what's coming down, and what about those EBP grants, and how does this CalAIM thing all fit together? And again, I think when we talk about TA, we have to make sure that TA isn't siloed in the same way that our systems are siloed, because the folks that know and understand managed care have to be able to also be in conversation with those who know all the educational funding streams, and we can't do that on our own. So when we look at these various opportunities, it has to be about coming to the table, defining what it is we want, articulating those dashboards, and then figuring out how we use the money to get us to address those issues, rather than the other way around. One of the things that we've been doing at the Alliance is developing, and we have our executive director here, Full Circle Health Network. And that is a hub that we've created in an effort to help community-based organizations actually understand and build relationships with managed care organizations, because they can't do it on their own. And the ones that are going to be left behind, just like those rural school districts get left behind, are the very local, often most culturally responsive organizations that do not have the bandwidth to understand our lovely government systems and funding streams. And we have to build those kinds of opportunities and support organizations working with schools so that they can get the work done and we can figure out how it gets financed. How's that for wrapping?
Perfect. Perfect, Landon. Thank you all. Big round of applause to our panel. Thank you so much.